Children's, and Jeannie Huang is the Director of Continuing Medical Education and a Professor of Pediatrics for the University of California, San Diego. So Dr. Huang, Dr. Kuelbs, it's all yours.
Thank you. Can everyone hear me?
Yes.
Okay, great. So this is Cindy speaking. I'm sorry my video is not showing. And I want to really thank Betsy for your great words on the utility of OpenNotes and how important that is to patient care and engagement, as well as to John and Liz for organizing this. And then Chetan, thanks for sharing your journey as well. You're great colleagues up there. We appreciate all the work that you're doing. Can we go to the next slide, please? So we're talking about our experience with adolescent note sharing. For those of you who don't know us, we're a quaternary care freestanding children's hospital. It's affiliated with UCSD in San Diego County. We have a region that's fairly large geographically. And can you go to the next slide? You can see our volumes there. We are part of an integrated delivery network, which is comprised of the hospital, the specialists, and our primary care providers that are kind of lumped between a couple of groups that have about 150 primary care providers total on our version of EPIC. Next slide. Our OpenNotes journey took a little while, not dissimilar to what Chetan spoke about. We had some pioneers in our developmental services clinic back in 2015 who started releasing their notes. And we did develop an early teen MyChart, but really didn't have many teens active on that, and there wasn't anything for them to see. We had tried the opt-in method. It didn't get us any traction, and we went to our Family Advisory Council, to our parents, who wrote a letter to our patient engagement group saying, we need to have notes available. This is an important piece of information, and based on that, we then went back out to our different physician leadership groups and called for auto release in all areas. We didn't want to, the pilot had opt-in, wasn't really getting a lot of traction, as I said. Our primary care providers took lead on that, and in 2017 started to auto release. And then we started to develop share in specialty clinics in essentially late February, early March of 2018, then to the inpatient discharge summaries in May of 18, and to our emergency department and urgent care in August of 18. Our teens do have access to the patient portal starting at 12, which requires parental consent, and all information is shared with teens unless it's marked sensitive, including the notes. Next slide, please. One note to that is while we share the notes with the teens, we do not share them with the parents at this time, and we're working on a way to be able to do that. As Chetan pointed out, it's not granular enough yet, and so because of the issues around reproductive confidentiality, we are not, and we recognize that that is a big gap because the vast majority of the notes don't have that type of information, and so we really want to get this information out to the parents as well. So we're going to provide, these are some ambulatory data from the time that we started to release in March through the end of 2018. We've created about 240,000 notes in our specialty clinics only, and because we have the ability to mark a note as sensitive and not be shared, we had about 86% that were available to be shared. The rate of marking a note as sensitive varies greatly among the specialties, so we're now that we have more granular data able to go back to the specialties and try to understand why they're marking a note as sensitive at a higher rate than others. And what's been surprising there is the specialties that you think might mark a note as sensitive are not the ones that are actually doing it more frequently. That was a bit of a surprise. But of those are about just under 100,000 were available to MyChart accounts, and our read rate is really very low, about 2.5%. Of note, we haven't done any marketing of this. That was one thing that we worked with our providers on is to go live, default release the notes, but not really heavily market. So I was happy to see the marketing materials from Stanford because that's our next step that we need to do to increase that. Next slide, please. And finally, relative to our teens, we had about, that's not showing very well, but we had about 78,000 notes involving teens between the ages of 12 and 17 written in the time frame of March to December. Of those, about 5,500 or so were written for teens with logins, and we have about 2,400 teens with a MyChart login. We had 163 notes read by a teen, with an average number of notes read by a teen 1.5, the median 1, and then the maximum 10. So there's one patient who's got a lot of notes and is reading them all. We've had no issues with this that we have found through health information or anecdotally in asking providers who are sharing the notes with the teens. And I'm going to turn it over to Jeannie, who's going to go into more detail about a study that she's doing and sharing notes with the teen patients.
So thank you very much, Cindy, and thank you to you all to have this forum for me to share some of the work that we've been doing, but also it's great to have some compatriots kind of in this effort. So I'm going to talk to you about a study that we did amongst adolescents and young adults in regards to the understanding of their own medical record. So next slide. So as you know, in terms of the background, as already mentioned, through OpenNotes, adults who read their medical visit note report being more in control of their own care, increased medical adherence, increased self-care, and having better relationships with their physicians. And so that's really exciting. But unfortunately for adolescents and young adults, that's not true. More across the board than actually true that they can see their notes. And this is despite the fact that we are all, for pediatrics in any case, who particularly take care of chronic care kids, are urged to really start to prepare them for the transition from pediatric to adult-centered care. Nevertheless, there is this reluctance to share with adolescents and young adults, and I will refer to them as AYA as well. This is due to concerns with comprehension, potential patient harm, and confidentiality, as mentioned before. So next slide. So we had this opportunity with, again, Dr. Kuelbs kind of moving us forward towards OpenNotes, which was wonderful, with this natural experience for us to see kind of how adolescents would react to their medical notes, again, starting in late February. And so we were, again, default released medical notes to patients 12 years and older. And again, there were some exceptions with clinics with known confidentiality issues, as mentioned before, particularly our adolescent clinics, our gynecology clinics, and then we do have a child abuse clinic here, so we did not share that. In addition, there was also a secondary guard with physicians who could opt out of that sharing. So next slide. So participants in this study were AYAs, 12 years and older. We decided to look at actually chronic care kids because we felt that they might have some greater interest in reading their notes. We went forward with our study, which was going to get, again, the teens' opinions about their notes through our IRB, and it was actually really quite interesting putting that study through because the IRB itself said that why would you ever want to share notes to young kids, which was kind of interesting. Well, I want to do it because I want to learn what they're doing with them, but also to dispel any myths that people believe which are not true. So all participants provided assent, and then parents provided informed consent. So next slide. In regards to our methods, we printed out notes and participants who wanted to participate. We gave that to them at their next clinic visit, before their visit actually. We had them read their medical note, and then they were surveyed on an accuracy scale of 0 to 10, 0 being not accurate at all, and 10 being 100% accurate, regarding how that note had documented their health problems and how that visit's events, again, that last visit's event had been documented. They were also asked to categorize their health status based on that note in 4 categories: healthy, fair state of health, poor but able to go home, or poor requiring admission to the hospital, as well to say yes or no to whether a change in medical management had occurred and whether they would like to edit the note. We also asked them if they wanted to, why they wanted to do that. We also did a quick test of health literacy, which is a short test of functional health literacy in adults. Again, choosing an adult health literacy exam, again, because we're trying to assess their ability to kind of move from pediatric to adult-centered care. Next slide. So, one of the questions, again, that's come up is about comprehension, and then we did ask some questions in regards to that, again, in that survey that I talked about before. But we wanted to have some standard to that, and so we did ask 2 physician readers to read the exact same note and answer the same comprehension questions regarding health status and whether a change in medical management occurred. We did look at a level of agreement between physicians, and it was quite good, 0.62 for health status, 0.77 for whether medical management occurred. And then we decided kind of the level of comprehension agreement between patients and then those physician readers. We then did group comparisons of those responses by gender, ethnicity, and age. The next slide. So we had 55 adolescents and young adults participate. As you can see, most of them were quite satisfied with their medical note documentation, as has been shown in adults, with mean accuracy scores 8.7 for health status documentation and 9.2 for office event documentation. We actually had good levels of comprehension, 62 to 64% agreeing with physician readers in regards to interpretations of health status and change in medical management. And very few, only four patients actually wanted to edit their medical note. But when they did it, with actually a really great insight. So kind of talking about what medicines they were on, that was inaccurate, and then also correcting allergies that they had. They did not express any concerns in regards to requiring or wanting editing of their note in regards to confidentiality. The next slide. So just wanted to go over a quick cohort demographics. Again, 55 AYAs participated, a mean age about 16 years, a slight predominance of males. I made a good Hispanic representation, which is consistent with our area that we serve. In regards to the chronic diseases that we saw, again, this was in the GI and the liver clinic. The majority of them were with inflammatory bowel disease, but we also had chronic liver disease, a short bowel syndrome, celiac disease, and reflux disease. Next slide. I know there's been some concern about age, again, because it's a broad age group that we're talking about, 12 years up to 20. But I wanted to point out that actually our health literacy assessment, most of our participants were adequate. There was only one that was marginal in the youngest group, and that still was not significant in terms of comparison across age. Satisfaction with documentation was, quite good across the board. Again, no differences by age. There was a little bit of maybe lower comprehension for medical management change in the youngest age group, but again, still not statistically significant. And when you looked at other group comparisons, ethnicity or gender, really there was no difference. The next slide. So conclusions are that AYA with chronic, in this case GI and liver disease, but we would say chronic disease in general, generally comprehend and are quite satisfied with their medical documentation at medical visits. Our findings suggest that concerns regarding health literacy, comprehension, and potential for harm appear to be unfounded, and thus we would recommend that pediatric medical institutions reconsider releasing medical notes to these youth who may reap similar benefits already seen amongst adult patients with access to medical visit notes. So thank you very much.